Welcome to Roadie Wellness, where we explore all things health and self-care. Whether you're seeking mental clarity, physical fitness, or insight from students like you, we've got you covered. Welcome back to the Roadie Wellness Podcast. I am Olivia, and I'm here with Dr. Jeff Bratberg today. He is a clinical professor of pharmacy practice here at URI. Thank you for joining us.
Thank you, Olivia. I'm great to be here.
Yeah, so can you tell me more about what you do here at URI?
Yeah, so I'm a pharmacist and a clinical professor, and one of the things that I do is work with the health department and students we actually have a podcast called The Regimen, so I've got to cross-promote here, and I've taught a class called Communicating Vaccines, and we study vaccine confidence and figure out ways to promote that. So that's been an exciting thing I've done for over a decade.
I know right now we're in the middle of fall. I've heard a lot of people talking about that we're approaching flu season, right? So, what does that mean, and when would you say, the flu season is?
So one of the things we teach is really sort of October through May. Mm-hmm. It usually peaks in December or January. What we teach is that maybe in March, actually, it peaks, which may be due to, again, depending on the population, how much the immunity wanes. So we always say, don't get vaccinated in August. It may sort of wear off your protection. Now is the perfect time to get it, and we'll talk about that later in terms of travel coming up or things like that, and finals. Nobody likes to be sick at finals. But usually October through May, and there's ways to track it. You can just Google Rhode Island respiratory virus panel, and you'll see sort of what flu is happening, or I guess just talk to health services, and they'll tell you we're seeing a lot of people with flu. So
It's definitely a longer time frame than I originally thought, honestly.
Oh, yeah. So, and I think the thing to think about is you go, okay, so what's different about October through May than the summer? You're inside, you're around lots of people, you're in school. There are the holidays. We usually see a bump after December, right, where there's more flu cases. And they track the cases both in how many people are complaining of flu symptoms to their doctor. So there's certain sort of sites around Rhode Island and lots of states that track that. How many people are going to the hospital, and of course, how many people are dying. So we look at all of those.
Speaking of school time, right? I mean, I'm a college student myself. I think I can speak for all of us when I say we don't want to get sick.
No.
But unfortunately, I feel like we do get sick all the time.
Oh, yeah.
Being around so many people, doing things with big groups. What's some ways that we can, prevent sickness as an individual, but also just, as a community?
Well, I like that you talked about individual and community, because a lot of vaccination is protecting both groups, yourself and other people. I mean, I guess the joke I say to my students is that college is easy to stay well. Just get enough sleep and reduce your stress and eat right and exercise and have healthy relationships, right? Those are all easy things. Well, we know that that's not true, right? There's stress, there's loss of sleep, those kinds of things. Maybe we're not eating as well as we want. Those are all still good things, and don't feel bad if you're not doing those things. But vaccines are a really easy way. You get a shot. If you do get sick, it's less likely to be flu or COVID if you have protection against those diseases. It might just be a cold. If you do get exposed and test positive for flu or COVID, the vaccine will make it less likely that you have longer symptoms, especially for certain folks. More rarely among college-age students, you'll be less likely to go to the hospital and things like that. And it does make you less likely to infect your roommates or other folks around you. You're able to come to class, you're less fatigued. All those kinds of symptoms are in lower duration, lower severity. So it just makes sense the vaccines are part of wellness. It's the Wellness Podcast here. I'm sure you've done talks on nutrition and sleep and stress and things like that. Vaccines just fit perfectly into that mindset and lifestyle.
Yeah, it helps benefit the physical health, just like all these other pillars of health.
In fact, I think it protects your mental health is that you go, oh, I now have a runny nose or I'm sick, and you go, well, wait a second, I got my vaccine 2 weeks ago. It's less likely it's flu. I think when people say they have the flu, they more likely have other viruses, because flu knocks you out. Have you ever had the flu?
Oh, yeah, I agree. It does knock you out.
You don't even want to even get tested because you are out for a week, right? You are just down for the count. My partner's a teacher and I'm a teacher, and so we start feeling symptoms. We have kids, so we get symptoms and we go, oh, what is this going to be? And we're like, wait a second, we're vaccinated. So kids are vaccinated, we're vaccinated. It just reduces that sort of worry about oh my God, I have to take the entire week off next week, or I can't go on that plane or things like that. So it's just about preserving your future, right? And so when we've got other things going on, we can deal with those, and it's one less thing to deal with.
Especially in college too.
Oh, yeah.
Because now you don't have to worry about, I might miss my final next week, or my project.
Oh, yeah.
Or my friend's birthday.
Yeah. It's funny. My freshman year in college, I was absolutely sick as a dog on my birthday, and Yeah, I think we made it up a week later, but it was sort of like, oh, thanks for bringing me soup on my birthday. But like that person's at risk now, right? So, we're all good about protecting the community. There are data that says that you can reduce transmission to other folks. Of course, if you have symptoms and a fever, you should wear a mask. I see people around campus wearing masks. But again, you're less likely to need to do that if you've been vaccinated.
Mm-hmm. So speaking more about vaccines, I know you communicate a lot of those benefits. Mm-hmm. Can you talk about like the science behind it and like the efficacy a little bit more?
When we talk about college students is that you think you're immune to things, but you do get sick. So it's like, well, are you absolutely immune to everything? There's something called the health belief model, which is you do things to keep yourself more healthy, which you guys talk about, but you also do things to avoid being unhealthy, and vaccines sort of approach both those things. What's great about vaccines is that instead of risking getting infected and that will be down for the count, you get pieces of a virus or a bacteria or viruses or bacteria that can't cause the full disease. They rev up your immune system so you're protected against it for the next time. Flu, COVID, measles, all those things, you can get protection either for a season or in the case of measles, you're protected for life if you've gotten vaccinated. So there are safety concerns. It's a big concern of lots of folks. I always say that to my students who give vaccines and when I give vaccines that, yeah, your arm's going to hurt or you might be tired from it. Gosh, millions and millions and millions of people, billions of people have gotten COVID vaccines safely and effectively. They've gotten the flu shot. It's recommended by federal and state authorities. You can get it anywhere. It kind of makes sense that if there were lots of safety problems, we'd have that. Vaccines are really not linked to some of the things that a lot of influencers and folks say. It's great to listen to people online or however you get your information. A student told me TikTok is a great source of information. Okay, that's great. But wherever you're getting it, just be critically reviewing it and talk to your doctor. I think the key thing, your doctor, your pharmacist, your nurse, health services will give you the facts. We see the problems too. There's a little boy who was unvaccinated, got influenza, and complications from that. He lost legs from that complication. Those are real things and real people who have had real suffering from the diseases, from COVID, from flu, from RSV. I always say that if a disease is preventable, like get all the protection you can get.
Mm-hmm. And like you said, even if you do end up getting it after vaccination, it prevents you from getting more to severe. That level of, severity in which you have severe complications.
Absolutely. And again, if you get in the habit of getting a vaccine every year, then when you become a parent, you'll get vaccinated because parenting is tough and it's another job to probably other jobs. And then you'll get your kids vaccinated and then they'll be protected and they'll be in school longer. All these benefits really start in this time of college students' life where you have to go, okay, how am I going to, if you work out 3 times a week, you probably will keep doing that, right? So putting those healthy behaviors in motion now just makes it normal. And working out 3 times a week is probably a lot harder than getting 1 shot or 2 shots once in one day. 10 minutes of your time is really worth it.
Yeah, it's like starting that trend.
Yeah, exactly. But also understanding, hey, ask those questions. If you're concerned about safety, figure out those things, and then you can become the influencer to your friends and say, hey, I saw that clinic, at the Union, and I went and got vaccinated, and I was totally fine. Mm-hmm. I can say that because I'm a professor and I teach public health. But if you say that, Olivia, to your friends, they'll be like, oh, now I feel like this is a normalized thing.
And there is a lot of stigma around vaccines, especially like the post-COVID era.
Oh, yeah.
And do you mind doing some like myth busting in a sense?
I think that people sort of conflated this idea of, oh, I was forced to get a vaccine to work or to go to school, or I was forced to test or forced to do that. We know that even though those mandates worked really well to keep people safe and alive and going to school and going to work, people don't like mandates. So, okay, fine. Even though they work, they don't want them. That stigma has attached to, well, I was mandated to get this vaccine that's unsafe. That's not true, right? It's the most tested kind of medication that we've ever done. I would say that COVID vaccine is probably safer than a lot of the things you can go into your pharmacy and buy. So we have to kind of relate these relative things. Again, billions and millions of people got all the strains. It was a very closely followed process. The type of technology used to make those COVID vaccines is really revolutionary and allows us to create vaccines against COVID as it changes and also other viruses as they change. So even though people go, oh, it's a new technology. I mean, when I got my first shot now 5 years ago, December of 2020, it was the first week the vaccine came out. Even I thought, is this really the thing? But I knew that the trade-off is, I know this has been tested. I know that mRNA vaccine is actually probably safer than vaccines that are able to infect but not cause disease. So it's a killed vaccine. It's actually just parts of the RNA that activate production of proteins that your immune system reacts to. So when I get exposed to COVID again, just like, again, the vaccine I got a couple weeks ago, I'm not going to get disease, or I'm going to get a far less severe disease. That's the fact. These are safe, they're effective, and it's more effective when more people get them. That's why I always say, you think about who you get information from for your health. Talk to your parents, encourage them to do it, right? People listening. Mm. And the more people that get it and normalize it, I kind of want there to be FOMO for vaccine.
Yeah, because then if it's like all your friends are not sick and you're like, oh, well, I keep getting the flu or something.
I keep getting the flu, right, yeah. As we see the stigma against vaccines increase, we had 2 deaths due to measles. That's the most ever in 30 years, I should say. Canada is going to lose its measles elimination status. They had 5,000 cases of measles in Canada. 95% of those folks not vaccinated against this entirely preventable disease. So the caution for vaccines is, you could say, I can tolerate getting the disease. I'm not going to die from it. I don't have any conditions to do that. But who in your class has asthma? Who's being treated for cancer? Whose person that you're working with is going home to someone who has a new cancer diagnosis? This is the perfect time to get vaccinated, to get your immunity to a point when you go home for the holidays or for J-term, you're going to be exposed to people who are at much higher risk of the severe effects and deadly effects of these preventable diseases.
People are going home to see their grandparents or elderly relatives.
Exactly.
Or even young cousins, like you said.
Babies too, yeah.
Yeah, it's important to build that herd immunity.
Exactly. So people don't like to call it the herd, right? We don't want to be part of the herd, but community immunity is sort of the other thing, to say, like, we all have a part to play. And again, it's really such a minor trade-off to have a sore arm or be fatigued. For some people have a very severe effect. Look, I'm not going to deny that. And I encourage those folks to report that to their healthcare provider. But severe side effects from the vaccine are much less frequently seen than from the effects of the virus infection. And
then, where can students get vaccinated, whether on campus, off campus? I know we have a lot of resources at health services.
I'm going to just bring a really exciting thing. So for people who fear needles, which are a group of people, there's a nasal vaccine for healthy people aged 5 to 49. And now this is the first year that you can actually have that vaccine come home, and you could administer it at home. But you can get it at any pharmacy. You don't show your insurance card. You can make appointments. I help pass some of the laws in the state to allow pharmacists to do that. They're all trained. You can go to your doctor's office. You can go to their flu clinics. Again, health services, you can make an appointment there or go to one of those clinics. There's so many ways to get it. We know that there's lots of people who are willing to get vaccinated but don't. I was at a class. I said, hey, did you know there's a flu clinic today? They're like, yeah, I walked by it. I went, okay. So why didn't you go in? You saw the sign. And so it's really motivating. I think friends saying, hey, today's the day that we all get vaccinated, whether you're in a Greek organization or some kind of group where you're like, hey, we all want to be protected for that event coming up, or we all want to be protected so that we all do well in finals. Think about making this sort of a group effort, just like an exercise buddy or an accountability buddy or your project partner. You all take on roles to do that. I think health is one of those things. Like this morning I did Peloton with my friend, and all right, we got to get up and do this thing. That's how we get things done. I think vaccines and health are part of that too. It's sort of like, hey, I saw that flu clinic. Let's make appointments and go down there and have lunch after. We can make it part of our routine.
Well, that's all the questions I have for today. Thank you for joining us.
Yeah, no, it's been a pleasure. I love talking about vaccines, and I hope people hear the message. And again, it's just as important for you to get vaccinated as everyone else. So spread the word if you've heard something good and you went and got it. Thanks, Olivia. Appreciate it.
Before we wrap up, a quick reminder that all information shared in today's podcast is for informational and educational purposes only. Thank you for listening to another episode of Roadie Wellness. If you like what you heard today, tune in every Tuesday on all podcast platforms for more. If you want to stay up to date on events and healthcare tips, please follow us at URI Health Promotions on Instagram. And if you have any ideas for future podcast episodes or more social media content that you'd like to see, please feel free to DM us or email us. Until next time, take care and stay healthy.